So our next talk, and last before the next break, is Laurence Henson, coming to us from the University of California at San Francisco. We'll be talking about the development of a pilot head and neck contouring and plan evaluation telehealth curriculum for existing radiation oncology centers in the Philippines.
Hello, I'm Laurence Henson. I am a fourth-year medical student from UCSF, and today I'm going to be talking about the pilot head and neck contouring and plan curriculum in the Philippines. I have no conflicts of interest to disclose, but first, let's talk about a brief introduction. I was born and raised in the Philippines, and this is a video and a picture of my hometown, Nueva Ecija in the Philippines. So this project is very important and very near and dear to me, as it allowed me to reconnect with my fellow countrymen, and I hope you'll enjoy the presentation. So a bit of a background. A variety of studies have suggested that low to middle income countries account for a significant percentage of the global burden of cancer. If you see here on the right, you can see in the data that 3 continents, Africa, Europe, and Asia, have the most amount of low to middle income countries, or LMICs, accounting for more than 70% of the global burden of incidence and mortality of cancer. And this can be due to a lot of causes, but most pertinent of which is that there's a limited amount of resources that these countries have with regards to screening and diagnosing cancer cases. And this delay in screening and diagnosis can result in much more advanced disease that may require non-standard treatment, that may be outside of the guidelines. But you're probably asking, why should we care? Well, LMICs, as I mentioned, have more undiagnosed and untreated cancer patients. And as I mentioned, they result in more complicated cases requiring advanced radiotherapy. However, they also have a higher patient-to-physician ratio in LMICs, which reduces the time to gain experience in treating advanced disease, given the amount of time it takes to accrue experience and gain the necessary skills to become a skilled radiation oncology physician. So this feeds into a cycle where the capacity of LMICs are effectively reduced because more and more advanced cancer cases are popping up, and less physicians are able to effectively reduce the cancer burden in a country. So the goal of our study is to try to mitigate that effect, where we found that we can pilot a low-cost remote curriculum for radiation oncology training programs in an LMIC, such as the Philippines, and use standardized assessments to see how well we're doing in this pilot program, with the ultimate goal that we can approve and adopt this curriculum for other LMICs so that we can provide low-cost training for all physicians across multiple LMICs. So we chose the head and neck contouring and plan evaluation because we've surveyed some key opinions across the Philippines. We talked to several physicians who represent multiple centers, and they think that this is their most desired area of improvement. They have a large volume of weekly cases, up to 25 a week per center. And it's also of high interest for our educators and learners. Of course, given the high volume of cases, there's a high potential of positive patient impact. For this project, we'll be partnering up with ROECSG Contra Cancer, a nonprofit which has several affiliations across the United States with several universities and physicians. And we will also be partnering up with ProKnow, which is an online remote contouring tool, which is an analytics platform that we will be using to provide remote learning. And this is a sample of our orientation taken from last week. You can see here that there's 2 resident physicians demonstrating how to use ProKnow for the H&N contouring. You can see here they're demonstrating how to contour a specific part right here. And they're also showing how to upload and de-identify case. And as I mentioned, we will be administering pre and post assessments to evaluate the effectiveness of each session. The curriculum format will be primarily case-based, and each session will primarily consist of about 1-hour sessions starting on the end of May for about 3 months. And each session will be composed of a pre-session case, de-identification, and upload. They will be patient contouring of a specific structure that the educator requests on every case that they've uploaded. And then the educator will be demonstrating how they contoured that specific case for each participant. Then at the very end, there will be some time for feedback, discussion, and answering some questions. And we will be repeating steps 2 to 4, depending on how much time we have left. And you can see here on the right, this is our planned curriculum for the next 3 months. As I mentioned, we will be starting at the end of May. So in summary, we found that for our educators, we recruited across 8 different US institutions. We found that we recruited 8 head and neck radiation oncology educators, 2 rad-onc residents, and 3 dosimetrists. With regards to our learners, we've recruited all 8 academic centers that offer a rad-onc residency in the Philippines. Each one is composed of approximately the following number of rad-onc attendings, residents, and medical physicists. And as I mentioned before, the caseload is up to 25 new head and neck cancer cases per week. This was taken from our orientation last week, May 7th. We've had an amazing turnout with over 30 total participants across all 8 centers and growing. Several of them have expressed their interest in inviting their colleagues and attendings to join in this curriculum. And we surveyed them following the orientation. This is part of our pre-assessment. And of the 25 respondees, we can see here that a significant majority of them are second-year residents. And you can see here that majority of the support that they receive and training they receive with regards to plan evaluation and contouring are primarily from informal support provided by online resources. You can see here in the results that this is also part of our pre-assessment, and this is based on a 5-point confidence Likert scale. And what I want you to focus on is that more than 50% of them, for the most part, do not feel confident at all, or only feel a little bit confident with regards to contouring cranial nerves, managing dose constraints, planning for modifying a plan, and knowing when and when not to treat. So this is something that we wanted to focus on the coming weeks. This is something that we would like to improve and hopefully see some significant improvements on. So in summary, LMICs have a high cancer burden that requires specialized training. We know this from several studies. And that their training is limited based on what we surveyed from several resident physicians. They usually have to go out of country or incur several out-of-pocket costs to acquire advanced training for their specialty. We also found that we can provide low-cost training that we can provide remotely, and there is a significant amount of interest among US rad-onc professionals to provide education. So what we found was that given the high interest in head and neck contouring in the Philippines, we're currently assessing the effectiveness of our curriculum, and exists a significant amount of gap in contouring and evaluation among rad-onc residents in the Philippines. Our tentative start date is on May 26, 2020. I'd like to thank the following for making this project a possibility: Dr. Benjamin Lee, Dr. Rochelle Backley in the Philippines, and Hannah Rees. Thank you all for listening, and I'd like to open this up for questions.